Stimulate ICP is a 2-year study funded by the UK's National Institute for Health Research in a specific funding call for long COVID research. It came about actually because we were listening to patients and health professionals, and I myself am both a practicing doctor as well as a researcher. And in my case, I was seeing people with cardiac complications in the long term from initial COVID infection, sometimes months later. And so we decided that we need to, as my colleague and co-lead of this study, Dr. Melissa Heitman, says, we have to build the plane while we're flying it. We have to do the research while we're seeing so many people with COVID and long COVID. The best way to avoid long COVID is to avoid getting infected in the first place. We should not have been in this situation. And if you look at the countries where there is a large burden of long COVID, it's the countries where we've had unmitigated infection. That's the US, that's the UK, and a few other countries around the world that they have the worst burdens of long COVID. And that's the case here. So we have to, at scale, both map out the trajectory of disease. By that I mean who recovers, how quickly do they recover, who needs more help to recover, who's at risk of having prolonged symptoms and organ impairment in the first place.